As we age, life isn't always clear sailing. Aging touches each one of us, our parents, our children, and of course ourselves. Dealing with change or loss is an inevitable part of life. This is especially true as we age. When a significant life event, such as the loss of a spouse, touches our lives, the reaction to such an event varies from person to person. But what if such an event causes feelings of depression, anxiety, and isolation? What if these feelings result in difficulties coping? Is an older adult retiring from involvement in regular social activities a red flag? Is a decline in function reason for concern? What role does psychosocial assessment play in addressing anger, moodiness, forgetfulness, loss of hope, social withdrawal, and increased use of alcohol and drugs? Hello, my name is Attorney Ramsey Bahrawy, and welcome to Your Money, Your Life. Joining me to discuss the importance of psychosocial assessment and aging-related issues is Cathy Cress. She's earned her master's in social work and aging from UC Berkeley. She's a well-known authority in midlife siblings, baby boomers, and the aging family. She's the leading national expert in geriatric care management. In addition, she's the author of a handbook of geriatric care management, a text considered to be the Bible of geriatric care management. She also taught and lectured at Stanford, UC Berkeley, University of Florida, and numerous other universities and colleges. Ms. Cress is a prolific writer on aging, midlife siblings, aging dysfunctional families, and geriatric care. She most recently published a book called Mom Loves You Best. Cathy, welcome to Your Money, Your Life. It's great to have you on the program.
Thank you for having me.
Cathy, let's now focus on psychosocial assessments.
Okay.
Can you tell us what's involved in performing a psychosocial assessment?
Well, basically, again, down to, just understanding it on a really rudimentary basis. You're measuring change in an older person's life. And then you're measuring how are they coping with those changes, because aging is one giant change, and it's a decrement. That's what we call it. The change is getting longer and harder and longer and harder. So how are you coping with all of those losses? And a psychosocial assessment then measure those changes in the coping system, and then it fills the holes of that have been created by those losses. So it sort of if you think of Charlotte the spider, in Charlotte's Web, a geriatric care manager, aging professional, is sort of like a spider. You're filling in the holes of the safety net that have really been broken by all the decrements of aging. And it's really similar to a doctor. You go out, and what does the doctor do? They do an exam, they run a bunch of tests, and then they prescribe something. Well, a geriatric care manager, an aging professional, does assessments like a psychosocial or a functional. That's a test, like a doctor, like a blood pressure. And then they create a care plan to fill the holes in the safety net. And that's just like a prescription. So that's essentially what it is.
All right, so I'm coming away from what you just said with three key words, and they are changes, coping, and holes.
Exactly.
Okay.
Yeah, they're the three things that you really have to look at, because after all, isn't aging that? I mean, life has changed in the first place for every age. But, those changes and losses and holes, make you have real difficulty in coping in old age.
Cathy, could you give our viewers an example of measuring changes in a person's life and coping systems while at the same time filling holes in that safety net that you referred to?
Sure. So let's say that you have an adult child who lives long distance, and they call you up, you're a geriatric care manager, and they say, my elderly mother was just widowed. Now that's a giant loss.
Sure is.
And she is now very isolated. That means she's not coping well. not seeing anybody. And that's a huge change in her life. Say she's been married for 60 years, as many older people are. There's a hole in her life, a huge hole. So, and that hole is isolation. And, maybe she's not eating, maybe she's drinking more. And so, essentially, what you're going to do is create a care plan to fill those holes. Um, because her husband's been lost, and look at, how she's negatively coping, which may be using too much medication because it's been a huge loss, and maybe she got prescribed meds, but now she's using many more or greater dosages, and maybe she's drinking alcohol more. And so um, how to address that negative coping and fill those holes.
Okay, so if I understood what you just said, basically filling the holes in the safety net involves coming up with a care plan so that you can then address the issues that have caused this particular hole. Is that right?
Exactly.
Okay.
And it's just like a doctor.
Yeah.
A doctor gives you a prescription. A care plan is a prescription that aging professional or geriatric care manager creates to. A doctor fills the holes in your health. Geriatric care manager fills the holes in your health, but also in your psychosocial problems.
Now, it's my impression, based on what you've had to say so far, that a psychosocial assessment has several parts to it. So I have a two-part question for you. First is it true? Is my impression true, number one? And number two, if so, would you share with our viewers the sections of a psychosocial assessment?
Okay, well, like a doctor, and I keep coming back to this, but it makes it easier to understand because everybody goes to doctors. Physicians learn a protocol for exams when they go to medical school. And so basically, the protocol for doing a geriatric assessment, a psychosocial, is basically, particularly a psychosocial, it has 4 parts. And first you take the client's history. That's just like a doctor. But you need to know, how did they get to this place where they're having so many problems, and see them as a whole person. They weren't always a widow that is perhaps drinking too much. They might have been a very, they were married, they went to school. So find the history.
Right.
And the second part is to basically do the psychosocial assessment. And then the third part is basically figuring out what are the functional problems, and the fourth part is to come up with a care plan.
Older adults want to stay healthier longer, enjoy life while living in their homes. Today, people aged 65 or older represent one of the world's fastest growing populations. It's a population that requires unique medical and social services. This population, especially as its members reach the end of the life cycle, is vulnerable and needs services. This is especially true when dealing with a significant life event, such as the loss of a spouse. Although the reaction to such an event varies from person to person, it's not uncommon for feelings of anger, depression, anxiety, and isolation to appear. However, if these feelings result in difficulties coping, other issues may surface, such as isolation, decline in function, forgetfulness, loss of hope, and increased use of alcohol and drugs. This is where psychosocial assessment can play a significant role. As we learned from my guest, Cathy Cress, psychosocial assessment is an evaluation of a patient's mental, physical, and emotional health. It measures changes in a person's life and coping system. The psychosocial assessment also measures the level of available social supports and seeks to fill holes in the safety net. The psychosocial assessment usually takes the form of a series of questions asked by healthcare professionals. This assessment is used to create a comprehensive picture of the patient in order to map out treatment goals. Most patients have undergone a psychosocial assessment at some point in their lives. For example, the series of questions a doctor and the other medical staff members ask during a yearly checkup are a basic form of psychosocial assessment. With increased longevity, improved medical care, new hips, knees, and heart valves, we will all ultimately need to come to grips with the lessons of aging. So take charge of your future by doing your homework, for as Ben Franklin is quoted as saying, an investment in knowledge always pays the best interest. In closing, thanks to my guest, Cathy Cress, a national expert on geriatric care management, and as always, thank you to you, our viewers, for watching Your Money, Your Life. My name is Attorney Ramsey Bahrawy, Building a Trust.